Good morning. Welcome everybody to our Northern Arizona Spotlight Senior Services and Living Options networking group. What we do at Spotlight, we publish the Spotlight Resource Guide. It's called Spotlight Senior Services and Living Options. This is our Northern Arizona edition, and it's fresh, hot off the press. You can also find it digital. It's on our website at Spotlight Senior Services NorthernArizona.com. It's a beautiful day in April. We've had some snow in Northern Arizona today, so that's always fun in April. But it's great to see everybody. We come together like this in this format so that we can meet and learn about each other's services and how we can work closer together to serve the seniors in our community. And we do have a great program today. We'll be putting the spotlight on Maggie's Hospice, the Bluffs of Flagstaff, Yep Pike College education programs, and ASNAHA, the Arizona In-Home Care Association. So first, we want to hear from Maggie's Hospice. We have Michael on with us, Michael Berlow. Michael, you want to unmute yourself? The time's now yours.
Well, thank you, Kyle, and thank you, George and Robin and Spotlight. My name is Michael Berlow. I am I'm a family nurse practitioner, and I'm the program director for Maggie's Hospice and Palliative Care in Prescott and Cottonwood and Flagstaff. And I wanted to just start by saying that, over the last, 6 months or so, I've seen other presentations on Spotlight from hospices, and I certainly, don't want to repeat, information at other hospices. There were some good presentations, and I don't want to, belabor the point. So what I did is I'm going to show you my PowerPoint presentation that's got a little more data to it, that's a little more what we really do. And then if there's any time left over, which I'm not sure there will be, I'll take you on a little tour of our hospice. So I'm going to pull up, hope you all can see this okay. From the beginning, okay. So first couple definitions. This is from National Hospice and Palliative Care. Basically the first sentence here kind of defines what palliative care is. And palliative care is patient and family-centered care that optimizes quality of life by anticipating, preventing, and treating suffering. And really that's kind of it in a nutshell. As opposed to the definition of hospice, and I really love this. This is just an old quote from Bartalos, actually. Oops, doggone it. I've already messed up my own PowerPoint. Okay. Escape. Go back. Sorry about that, folks. So basically, hospice comes from the root of hospitality, and it can be traced back to medieval times, and it's as referring to a place of shelter and rest for weary or ill travelers on a long journey. And that really kind of just describes in a nutshell what we do. So with that in mind, I'm going to kind of show you my representation. I consulted with our graphics department, which is not true. Basically, I created a lot of stick figures for my own presentation here, so bear with me. This is basically the end of life continuum. Well, this is the full life continuum, and this kind of is a definition, my graphic definition of palliative care and hospice. So basically, looking at this whole arc, okay, you have from birth to death, you have what we call a curative or aggressive care, and we all have that. And that basically means that, if something happens and you go to the doctor, you break your leg, you break your arm, you get the flu, whatever, you go to the doctor, we can fix it. That's curative aggressive care, and that's what you have most of your life. But as we age, our bodies start to wear down, and at a certain point, you get to a point where you might get something and we can't fix it. And that can be something simple like constipation, or it could be diabetes, or it could be COPD, or it could be heart failure. But that doesn't mean that you are going to die. It just means you now have a disease that can't be cured with all of our modern medicine. That's when you enter what we call palliative care. And really the bottom line with palliative care is that we can treat it and make your life comfortable. And even though we can't fix your disease process, we can make your life comfortable, or as comfortable as it can be. We can give you quality of life. And the reason I mention all this is because we have had an existing palliative care program now for upwards of 7 years. And we are very active in the communities with palliative care. So it's just something, and then people confuse that. And so I'd like to put that out there, what palliative care is versus regular care. So, you know, as you continue to age, you get to a point in your life where, you know, if you have one of these diseases, a doctor might say, hey, you know, given what we know about your disease and where you are, we think you have about 6 months or less. And nobody has a crystal ball, but that in a nutshell qualifies you for hospice. And so the graphic representation here shows you that hospice really is part of palliative care, really with the same goal to give you quality of life in whatever time frame you have left. So basically palliative care is, this is my palliative care 101, person has acquired a life-limiting illness. We can't fix it. The goal is to maintain or improve your quality of life. Basically, a physician or an NP will work with your primary care physician. Palliative care is not for emergencies. We make monthly or bi-monthly visits or sometimes bi-weekly visits for supportive care. And really one of our goals is to reduce ER visits. And so I'd like to say that the perfect example of palliative care is your basic person who has COPD, kind of end stage COPD. And perhaps they have exacerbations 2 or 3 times a month and they end up in the ER for various reasons. Maybe they run out of their inhalers, or maybe they seasonal allergies or what have you. So instead of having to go to the ER, if we as providers can come into your home and assess you and treat you in your home and keep your quality of life and keep you out of the ER, we've done everybody a service. And that really is kind of what palliative care is about. So here's the big $24,000 question. What is the model for palliative care? Well, I heard this guy give a presentation and basically he said, if you've seen one palliative care service, you've seen one palliative care service. And really what I mean by that is there is no formal model that says palliative care has to be done this way. I have seen, so for example, here in Prescott, palliative care by YRMC Physicians Care versus our model is totally different. They have doctors and PAs and NPs and so forth. We have NPs and social workers, and we include chaplains. I've seen models that include CNAs. It really depends on the organization, but the goal is the same, and that's to enhance quality of life. So the difference between that and hospice, and this is again, my simple stick figure diagram that explains to layfolk what hospice is, how we really work, okay? So right here at the very beginning, the doctor has said to you, we think you've got 6 months or less. That puts you in what we call, we operate in CERT periods. So the first 2 CERT periods are 90 days each. After the first CERT period, after the first 90 days, a nurse will go out, they'll assess the patient, they'll present to the doctor. If the patient's still declining, then they'll say, yeah, still appropriate. Keeps them on for the second 90 days, the second CERT period. That is, in essence, your first 6 months. Basically what happens at that point is people don't get kicked off hospice. You stay on hospice as long as you qualify for hospice. And that means that you continue to decline. So what happens after the second CERT period is every 60 days, a nurse practitioner or a physician will go out and they will reassess that patient. And if they continue to decline, they go into their next CERT period. And that can go on and on and on and on. The flip side of that is if a patient stabilizes or gets better, they really need to graduate off hospice by Medicare rules. And so that again is another good use for palliative care. A nice transition from hospice back to palliative care to keep people, to be able to keep eyes on people so they don't suddenly decline, because sometimes when folks come off hospice, they lose that whole support system that was created by hospice, and then they begin to decline fairly quickly. So it's good to have that resource available to them. Basically with a hospice team, You get a doctor, CNA, nurse practitioner, social worker, chaplains, volunteers. There's various levels which we've heard about in the past: routine care, respite care, continuous care. And I'm going to talk about continuous care for a moment, and general inpatient care. Continuous care is something you don't hear about very often, and we at Maggie's Hospice are fairly proud of the fact that we do continuous care. In fact, we were almost doing it again yesterday. And basically what that means is a patient has a symptom somewhere out there in a home or group home or whatever that is out of control. Perhaps their pain has escalated, their nausea has escalated, something that if a nurse were out there for several hours, they couldn't get under control. So sometimes we move them into the Marley House or an inpatient facility for GIP care, general inpatient care. Many times if we can't move them, or we feel like we can treat them without having to move them, because it's quite an event to have to move a sick person, we do continuous care, which means we spend up to 8 hours with a nurse in the home providing care directly to the patient to try to get them under control. And that would be every day until the symptoms are resolved. So that's another nice benefit that's available through hospice. So just real quickly to talk about some of the things that, and we've heard some of this before, but hospice is certainly not about death. Hospice is about comfort. And so certainly the minute you say the word hospice, it freaks people out. But the reality of it is we treat folks for comfort, regardless if that's 1 day or 1 year or whatever it takes. We try to make each day the best day that it can be. And that's really what hospice is about. Now, a lot of times people think that they can go live in a hospice house. And while that might be true in some places where a facility might be dual licensed, here in Prescott, we don't really have a place you can go and live in that's a hospice house. Certainly you can live in facilities and so forth, but the Marley House that's strictly for hospice here is just for inpatient and respite services. It's not a place where you go to live. Some people think they can't afford hospice. Well, they shouldn't have to, because hospice is free. In most cases, certainly there are cases of younger folk that don't have insurance, perhaps a young cancer patient. But I know with our hospice, in many cases in that situation, we do pro bono. We don't charge anybody for hospice ever. And then people think that all hospices are the same. So I'm going to tell you conflicting things. Yes, all hospices are the same in that we follow Medicare guidelines, as do all hospices. And so in that regards, we all have a set of rules that we must follow to the T for Medicare purposes. So yes, all hospices follow those same basic rules. However, not all hospices are the same in that, and I use this example all the time when I tell people about, when I used to be a hospital nurse, if you are laying in bed and you have a broken leg and you just had it fixed, and the first thing in the morning, your nurse comes in and she says, I haven't had my coffee yet. I just, you're not going to have a very good day. It really boils down to the caregivers. So if you have good nurses and good CNAs and good chaplains, you have a good hospice. So really, the bottom line is, when you go to choose a hospice, you need to interview. You need to ask lots of questions. I tell people all the time, this is your journey. And so you have the right to go on hospice. You have the right to go off of hospice. You have the right to switch hospices at any time. You have the right to get a different nurse if you don't like your nurse. You have the right to get a different CNA. The bottom line is, this is your journey, your mom's journey, your loved one's journey. It needs to be the best journey possible for them. So don't settle for second best. A lot of people think that hospice is 24 hours a day. It is. But we don't come live in your house 24 hours a day. We make visits. We make visits that are an hour here, an hour there, sometimes daily, sometimes a couple times a day if we need to. But we're not live-in caregivers. And that's kind of the assumption that a lot of people make, that once they come on hospice, someone's coming to live in their home, and that simply is not true. And the other thing that people sometimes believe is that hospice is in charge. And we truly aren't. We are your supportive caregivers. We come into your home, we make recommendations to you. You are in charge. There's all kinds of myths out there that we come in there and we take away all your medicines, and no, we don't. If there's medicines, here's the example. I'll come into a patient's house, they've just been given a terminal diagnosis, basically told that they're going to live 3 more weeks. And I look at their med list and they're taking vitamin C and vitamin A and calcium and D and blah, 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 blah. They're taking a bowl of vitamins for breakfast. I have to ask, is that really comfortable? You know, if you've got 3 weeks to live, this medicine's not going to make a difference. I'm not going to take it away from you, but here's what I suggest. You've got heart medications that are important. Let's keep those. You've got seizure medications that are important. Let's keep those. But it's your call whether you have these vitamins or not. And that's what we do. We offer recommendations. And so I like people to know that they're in charge of their journey, you know, and really the bottom line with that is that they should be, and it's their last hurrah and they should be entitled to the best. So with that, kind of just flew all through that. Does anybody have any questions that I can answer?
Mike?
Yeah.
I'd like to hear more about the continuous care.
Okay.
As it, you know, pertains to like a hospice.
Well, so all hospices have the mandate of the several levels of care. So when we come into a person's home, you know, basically, if we're going out there 2 or 3 times a week with the nurse, we're doing routine care. If a patient, a caregiver, a loved one's caregiver needs a break, we can have that patient go into the Marley House or Valley View or any other inpatient facility for 5 days. It's called respite care, so that the family member gets a break. And really that's for the family member or the caregiver, not the patient. Then there's GIP care, and this is the distinction. So general inpatient care is that same scenario. So the patient now has some symptom that is out of control. It doesn't happen often. We are really good at managing folks in the home. But when it does happen, maybe it's a cancer that's really progressing or what have you, we could have them go into an inpatient facility. It's called general inpatient care. And they're basically there until we can get that symptom under control. Once it's under control, they need to go home. Ultimately, sometimes they never go home because they pass in some situations. But that GIP care is not infinite. It's only to control a symptom and go home. Continuous care, the way we run it, and really the way we've run it now, we have nurses, and it doesn't have to be 8 hours of a nurse continuously. We've had instances where we'll start in the morning, we'll have a nurse in there for 4 hours, then we'll have a CNA come for several hours, and maybe we have a nurse come back later in the evening for another 4 hours. It just has to be within a midnight to midnight cycle that a nurse is there for 8 hours, then you supplement the care. And so we've done that, numerous times over the last year, you know, and really the reality of that is when you have a patient that's that sick, to try to transport them to an inpatient facility, you always take a risk that the patient might pass in transport. And if their wish is to stay home, you know, we really want to try to accommodate that the best we can. So that's really how we've utilized our continuous care to its advantages.
Terrific. Thank you so much, Michael. I'm afraid we're going to have to leave it there. But thank you so much for joining us today and sharing that information. You'll find Nagy's Hospice in the current Spotlight Resource Guide on page 25. So their contact information is there for you. And if you have more questions, I'm sure Michael will be happy to hear from you. I want to take a moment now to recognize our co-host, give them a shout out. George Phillips with Just in Time Moving and Storage. We couldn't do it without George. George, you want to take just a moment?
Excellent. Yeah, George Phillips, Just in Time Moving. We do moving here in Arizona and long distance. So if we can ever be of any help, we are based out of the Valley here, but we do trips a lot of times up to northern Arizona area. So if we can be of any help, please feel free to reach out. I put my information in the chat. Thanks.
Fantastic. Thank you, George. Also want to recognize Robin Valentine. She is with the Spotlight program as well. Robin.
Hi, everyone. Just consider me your cheerleader. I'm here to serve you in any way I can. I'm really here to help promote the things that are going on in your communities and in your, the services that you offer. If you guys have events or support groups, or if you even have job postings, I'm happy to put those on our website and on meetup.com. Of course, the job postings don't go there, but anything I can do to serve you, I'm here to do that. So please reach out to me and I'll help you in any way I can.
Thank you so much, Robin. Appreciate that. Now we want to put the spotlight on one of our newest corporate sponsors, the Bluffs of Flagstaff. We have Leah Vecchio on with us. Leah. You need to unmute yourself there. There you go.
Can you hear me? Hi,
Yes.
everyone. I'm Leah Vecchio. So I work for the Bluffs of Flagstaff Senior Living Community. We are a new senior living community in Flagstaff. We're not slated to open until October, November of this year. We are an independent living and assisted living and a memory care. We have 2 buildings in our community. The first one is the assisted living and memory care, and there's 64 assisted living beds and 25 memory care. And then the building behind it is its own separate entity, is our independent living, and we have 123 beds. I've been working for the Bluffs since January, and I just wanted to talk a little bit about what I am seeing out in our community when I'm meeting with the patients and families regarding our services. And I'm seeing a huge trend of troubles re-entering back into our community as we're getting a handle on COVID and increase in vaccinations. There is such a huge loneliness factor out there. So I spend a lot of time talking to them, but more importantly is, pre-COVID, they had a lot of resources that they used. And when COVID happened, a lot of these people lost their private caregivers. And so families have been caring for them every day for over a year, and they're exhausted. So I'm really working to try to find the resources to get them reconnected with caregivers, with the services that are out there to help these families, be able to get their lives back and not be so tired. So I think self-care is really important. So I really want to tell all of you, when you're out there, keep that in mind, that these people are really tired and they need all the support they can get. So in the meantime, since we're not opening, I'm building a lot of professional referrals relationships out there so I can get that information to them. I spend a couple hours with them a lot talking about what they're going through. So anybody who would like to talk to me about that, that would be great. We have a Founders Club at the Bluffs currently. We are full. So we've reached our max capacity for Founders Club, but we meet a couple times a month. They're doing activities. I'm looking for speakers. So if any of you want to be part of that, please reach out to me. I'm looking for unique services. It can be anything, just to let them know what's available out there while they're still at home. So please reach out to me. My contact information is in there. I also wanted to talk about, I have a little bit different role than I did in my previous job. And so I'm learning a lot about what questions these families answer. And so I just kind of wanted to give an overview. If you are talking to any of your patients and families and they are talking about senior living communities, some of the advice that I think that you can give them is make sure when they talk about level of care, what that actually looks like. Senior living communities, levels of care are unique to them. Sometimes they're levels, sometimes they're hours, sometimes they're points, sometimes they're all inclusive. And they really need to get that defined so they don't have a surprise bill at the end of the month. And so I would highly recommend that they ask a lot of questions, what level of care looks like. So for us, we actually have 3 levels of care. So your basic level of care is your basic care, like, standby assist in a shower, medication management. And then it obviously goes up to there. Our highest level of care, usually when our residents would be considered on the higher level of care, we have support services like hospice already involved with those residents. So that can help. But those are kind of the questions. When they say they're all inclusive, you want to be specific to what that really means to them. Is it include linen, laundry? Does it include housekeeping? Does it include meals? What does that meal plan look like? I'm learning that each of the senior living communities, again, are unique. Our memory care is very unique from what I'm experiencing out in the communities. We are an all-inclusive memory care. So the level of care is built in the monthly price. So there's no extra fees. And I happen to really like that because I don't think you can put a price on a level of care when it comes to memory patients. You know, they're each so individual and unique and have their own little challenges, and to base the level of care based on those challenges, I think are not really fair to these families. They're paying a lot of money to have their loved ones in memory care. So I like the fact that it's a one price for them, unless they reach, again, the highest level of their care needs. When they're getting close, they'll be on hospice. Those kind of conversations start happening. So I'm really glad, Michael, that you had a lot to talk about hospice, because we work with hospice very closely as our residents age in place. So those are some of the things that we're talking about. For the Bluff specifically, again, we're not opening in until the fall, but we are taking deposits. They are fully refundable deposits, and you can reserve your apartment of choice. So if you like a specific location, our independent living is filling up quite rapidly. The third and fourth floor are the ones that have the beautiful views of Mount Eldon and San Francisco Peak. So those are popular levels. So if you know anyone that's interested, we have that available. We will be putting on events throughout the summer, again, not just for the Founders Club, but for the community and our professionals. So please, if I'm not in contact with you on a regular basis, please reach out to me, because I would love to include you in any of those. I'm looking at a message. I was the DON and AL in memory care. Yeah, I agree with you. I never worked in an all-inclusive memory care, Shannon, but I think that that's just the way to go. I think it's the right thing to do for our patients and our residents and families. So again, I'm looking for support services that I can partner with, because I'm getting a lot of people asking me where to go. And since we're not open, if there's people that you know would be a great community, if you could get in contact with me. That's all that I have.
Terrific. Thank you so much, Leah.
You're welcome.
Do we have any quick questions for Leah?
I have one. Hi, Leah. This is Will from the Peak Senior Living. I'm just wondering, when you say you have a third and fourth floor, do you just have one dining room on the main floor, or do you have several dining rooms within the building?
Great question, Will. Our independent living has its own dining room on the main floor.
So are all the third and fourth floor individuals coming down? Like, does everyone eat in the same dining room?
Yes, yes. And our restaurant is quite large, so it takes up a lot of the first floor.
Thank you.
You're welcome. Thanks,
Leah. This might seem like a silly question, but how many elevators do you guys have?
That's a great question. I even know the sizes, but I'd have to look it up, because that's a question that the residents ask me. There are 2 elevators, one on each side of the building, in both assisted living and the independent living building.
All right, well, those are some great questions, if I can say that. Thank you again, Leah, and we appreciate you guys participating in Spotlight and for your corporate sponsorship. You'll find the Bless of Flagstaff in the current Spotlight resource guide on pages 10 and 11, as well as 40 and 41. So more information there for you on how to contact them. I think we want to move on. We're going to hear now from the Yavapai College, the education programs there. We're very happy to have with us Nancy Bowers. Nancy.
Thanks, Kyle. Thanks for inviting me in today and giving me a chance to talk about our allied health programs at the college. The allied health department handles the caregiver, CNA to caregiver bridge programs, nursing assistant program, phlebotomy, medical assistant, and there's a number of certificates and degrees in that. And then we also handle the nutrition courses at the college. So I just wanted to let you all know that we do train caregivers and nursing assistants, and we'd be happy to do that training for you. There's a big need out there, and we really want to be able to help you get all the caregivers and nursing assistants that you need. Our next classes for caregiving are going to start in August. So they start like August 16th. The first one goes August 16th to September 10th. The students will go it's 8 hours a day, Monday, Wednesday, Friday, in order to finish the class. And then at the end of their coursework, they take the state test with DNS Diversified. The second class that we'll have in the fall starts on September 20th, and it ends on October 11th. And we'll be adding a Verde Valley class at the end of the semester for fall, probably, unless you reach out to us. Let us know if you need a class before then, and if you can get, 7 to 10 students, we can build something in there, to meet your needs. So just let us know what you need, and we're happy to work with you. The cost of the program for caregiver, the tuition is $431, and then the test is $65. And then the cost for the bridge program is $248 tuition, and then $65 for the exam. And we always welcome your input about, what the obstacles and the challenges are to bring students to these types of training programs. And some of the input that we received in the last few months was that there are some obstacles that the students face when they go to register, especially if there's like a third-party payment. Maybe your facility is covering the cost of the tuition. And so our process was kind of cumbersome, and we've worked with our business department and also with our academic advisors to make that process less difficult and to offer support in a variety of ways. Pre-COVID, we would just meet with the student, but face-to-face, but now we're prepared to offer Zoom meetings and one-on-one or as a group. And that can be done for the student and for the facility to help navigate, how to get students in. So let's see. The other programs that we have a phlebotomy certificate program, and that's a very active program. We offer that at the Prescott Valley Center and also in the Verde Valley. We also offer classes in the Verde Valley for our medical assistant program. So students can take classes there face-to-face, or they can take them online. They can take them web live. It just depends on how it's being delivered. The Verde Valley campus does have a brand new building there. It's Building L. It's been freshly renovated, and we just started using it, it would be a year ago in August, so this past fall. And it has brand new and really cool skills labs for caregiver, nursing assistant, phlebotomy, and medical assistant. And the nursing program also is over there, and they have wonderful simulation labs. And one of the visions of the college is that, we can share our equipment, our supplies, and our labs with outside agencies that may need to do some training. So, if you find that your agency wants to or would benefit from using simulation labs, just get in touch with me or with Mary Lou Mercado in the nursing department and ask. It may be that you can bring your individuals over and do some training at our facilities. So let's see. What else would you like to know? If you have any questions, go ahead and ask them. Nothing?
I have a question, Nancy.
Okay.
I'm in the home care industry, and it's been extremely difficult to find and hire caregivers and CNAs. I've heard a lot of around the country, smaller schools have actually gone out of business. Mm-hmm. Obviously, you guys are a little bit bigger than that. Do you see your numbers increasing at all? Do you see your head count down as well? What's things looking like?
That's a really good question, and I'm glad you asked that. I would say that our numbers are down for both nursing assistant and for caregiver. And I meet with the State Board of Nursing every month for one of their teleconferences. And I think programs are experiencing that pretty much throughout the state, which is kind of unexplainable because the need for caregivers and nursing assistants is always high and going up. But I'm not sure why our enrollments are down.
Yeah. It's a tough situation for us. Yeah.
Yeah, because we want to help train and get people out there in the workforce, but we're not sure why they're not coming. So if you have any ideas, anyone, about, what would make a program more attractive to those that need it, just, drop me an email, call me. We've made a lot of changes based on input from others, so. But it is kind of an unexplainable thing. We really don't know what causes this. Oh, I was going to mention too, other things that we can do for you guys is if you have job postings, you can send them to me directly and I'll get them out to the students. And then also the college itself has an employment board that you can find by searching employment on our website. And you can post your own positions there as well.
Hi, Nancy. It's Will from the Peak Senior Living in Flagstaff. Do you guys offer courses for dining services such as a CDM course or dietitian tech courses?
We don't. We haven't done that yet.
And when you're during your caregiver classes, do you offer a survey asking like what challenges those coming into your school are seeing out in the community? And what is the response?
What the challenges that they're seeing in the community from the students' point of view, or?
Yes, exactly.
Yeah, unfortunately, our survey, we don't get to survey them after they've gone out to the workforce. Right now, we're not able to do that, but that's something that we could do.
I know here at our facility, we're seeing a lot of challenges where we're hiring, we're training, we're sending to the caregiver course, and they're moving on for higher pay, or they can't find childcare, and so then they end up having to leave their job completely. Also, second part to that is most of the individuals make more money on unemployment, so most don't want to work right now. So I don't know how to alleviate that, and that's another issue we're facing, I believe, as a whole with all of us in this group.
Yeah, those are things that I've heard from people, as obstacles, and the rate of pay for their responsibility just really kills us.
So I have a question. It's Mary Lou from Maggie's Hospice. When you have your caregiver program and someone gets to be a caregiver and they're in the care homes, and then they decide they want to be a CNA, so they do the bridge program, which allows them to work in the hospital, or what's the incentive for caregivers to become CNAs as far as employment opportunities? Because the care homes will take whatever they can get, to come in and help with them. But when a caregiver says, I want to become a CNA, what are the job opportunities for them once they do your bridge program?
The CNA is what's required to work in long-term care.
Okay.
Yeah, and the hospitals are, they like to see CNAs just because of the level of care that the employee would have to deliver.
Right. We've had a couple of care homes because there are not enough caregivers. It is very difficult right now because of that shortage.
Yeah, it is. It's impossible. I really don't, envy those that are trying to staff. It's really, really hard.
Yes.
It's always been a hard business to staff, but now it's particularly difficult, I think.
It is. It's really serious because sometimes when you bring a patient out of the hospital, they need to have 48 to 72 hours of continuous care so that the care needed can reveal itself to the family to see what they really need to do. And even getting 24/7 care right now is next to impossible, although it can be worked out, but it's not like it was when you could call up and say, this is what I need. Okay, we got it. It's very different now.
Right, right. It really is. And then, you know, in the past 6 months, our family had, you know, the experience of needing caregivers. And, you know, I'm an RN, so I could do most of the, you know, care here at home.
Right.
But I also work a full-time job and I needed a lot of help, but I couldn't get it. There just are not caregivers available.
Right.
So it was really pretty tough.
Nancy,
Yes.
this is Jennifer. I'm sorry, I have my camera off because
Jennifer.
I had to move out to the house. I'm the nurse with Compassus.
Mhm.
So I just came from New York as well. What I'm seeing a lot is burnout. We're having a lot of burnout going through, and so I think that's what we're also all experiencing is with just the pandemic and everything, and that's probably what we're all experiencing. And when I was doing the training programs in New York, we would experience a lot of people that would just come through and they just have utter burnout, and they're fearful of entering into our you know, our profession. So we just need to reassure them that over the stigma and just let them know that they're there, we're protecting them and that we're training them.
Right. I agree with that so wholeheartedly, that it's not enough to just get them through their skills in their class. You really have to help develop their survival skills and help them to understand that there's a limited amount of time and these are the things that you can do. And if you can't get it all done, it doesn't mean that you're a bad person and a complete and total failure. That's
Exactly.
what reality is.
Yeah, yeah.
Teach them
It's
how to
hard.
survive it.
It's hard taking those critical thinking skills and just taking these individuals and not letting them know that they can do it. So
Yeah.
I think that's why we're seeing that shortage. Is just they're fearful.
Yeah, and I think that, you know, the minimum wage is, you know, what caregivers can earn is really close to what minimum wage is for some other jobs. And, you know, that's your competition.
Nancy, this is Cecilia with Visiting Angels, and I do definitely agree with you because our Flagstaff office, they raised the rates up there to $15 an hour, which is mandatory through the city of Flagstaff. But what we have to do is raise up the, you know, the rates and the price to the clients as well. But I wanted to ask you about the Bridge program. Is the Bridge program from caregiver to CNA?
It's the CNA to caregiver bridge is the one that we're doing. Yeah.
Okay. All righty. Thank you.
You're welcome.
I just want to thank you, Nancy, for joining us today and sharing so much important information on a topic that is a challenging topic right now. And thank you. You'll find Yavapai College in the current Spotlight Resource Guide. They are on page 31, and their information is there for you and how to connect. So thank you again, Nancy. We really appreciate you.
Thank you, Kyle. Thank you, everyone.
Next, we want to hear from Jude Terrace. Jude is with representing ASNAHA, which is the Arizona In-Home Care Association. Jude.
Hi, thanks for having me. And I'll give a shameless plug to George's company. My family used them when we moved. It was a nice, only about a 2 mile. It was only about a, whoops, what am I doing with my camera here? It was only about a 2 mile move for us, but moving sucks, whether it's 2 miles or 200 miles. So it was nice to have them, very professional and very easy. So enough stress going on with moving. They made it easy for us. So thank you to you guys helping us out about a year and a half ago. But yeah, I'm a board member with the Arizona In-Home Care Association. I was trying to change my view so I could see everybody. I kind of want to get a quick show of hands. How many people are familiar, have heard of ASNAHA, the Arizona In-Home Care Association? So I can see who my audience is. Okay, so it sounds, I'm glad I'm here because it sounds like it's probably about a 50-50 mix here. ASNAHA is a group that was formed back in 2008 to help oversee the better practices of home care in the state of Arizona. For those that aren't aware, we are one of, I believe, 23 states that still has no oversight or licensure of home care. So that's probably hard to believe that not only is there no oversight in Arizona, but that's about the same for about half the states in the country. And so Osna was formed at that time by a handful of business owners in the home care industry that wanted to see better standards and better care delivered for our industry. I became a board member actually about a couple of years after they were formed. And then I took a long hiatus and came back this past year as a board member. And so I just wanted to get everyone a little more familiar with who we are and what we do. I'm assuming most of the home care companies that are on here are familiar with us and hopefully members as well. But we also have a lot of affiliate members as well, because whether it's hospice or home health or whoever it may be, there's those opportunities from I guess a networking and a professional standpoint to connect with our industry as well there. We're really excited that we just, in our board meeting last week, came to a date on our annual conference. We had to put that on a one-year hiatus last year, but we are going to be back in March of this coming year, so about 10 months away with our conference. It's going to be in person. I think there may be also a Zoom type of element for those that might not be comfortable at that point. But we will definitely be in person March 4th, 2022. I don't know if we have the exact location, but I believe it will probably be in Scottsdale. It's a Friday, so a good way to kind of end your week there. For the agencies, we're lining up some great speakers from not just locally, but around the country as well to come and speak at our conference. And, you know, I think there's no time more than now where we need that, you know, whether you're a veteran like myself that's been doing this for over 10 years or someone new, boy, there's so much that's changing that I think this conference will be able to provide a lot of information for those in the home care industry. And then those that are wanting to get in front of home care companies, there'll be opportunities with the vendor booths and tables to be able to present and be a sponsor as well. So we'll be getting more information because we just got that date solidified last week, but look forward to that in the spring of next year. Also, if you're kind of wondering, you know, is Osna Haas something that's worthwhile to for yourself? From an education standpoint, we put on monthly meetings, which I guess, you know, as a statewide organization, you know, obviously, or I shouldn't say obviously, but quite honestly, it's more focused in the Valley. So I know it makes it a little bit harder for participation and attendance for the Northern and Southern Arizona groups. But I guess one good thing to come out of the pandemic is these Zoom meetings. So we're doing all of our education meetings on Zoom. You know, last week we had My CNA Jobs, one of the vice presidents from there, speaking about, of all things that we're just talking about, recruiting and retention. And we're staying with that theme next or this coming month. We have Stephen Tweed, who's an industry expert out of Kentucky. He'll be speaking as well on recruiting and retention, since that is indeed the absolute hot topic of our industry, and I think of the healthcare industry. I think of all industries in the country, really. So those are some samples as well of these monthly education meetings that we have that are really great information for home care agencies, managers, and owners of companies. I guess to kind of toot the horn as well a little bit about what we've done for our members. You know, with this past year, we provided value many folds over just by one simple thing. We were able to procure PPE at no cost for our members. It was wonderful. I'm staring actually right now at 2, 4, 5 boxes of N95s. I mean, the last time this year, we didn't even know how to get an N95, let alone if you did, it was probably costing you about $13 a piece. And we were able to get these all for free, whether it was masks, gloves, gowns, the whole PPE setup. So that right there, literally, like I said, many times over, paid for our membership, just being able to have access to that. Also, looking to my other side of my office here at our rapid test that we were able to get. for free as well by being members. That was super great and continues to be great when we need to get that quick test result on one of our caregivers or clients there. So those are some of the benefits of being a member, if that's something that you might think might be of interest for you. And if you're probably like most people on here and you're not in home care, but you're an affiliated type of business, know that being that we are an unregulated industry, that when you refer out a home care company, it's a safe practice to know that if you refer a OSNAHA member company, you're referring one that has been vetted by the organization. And in order to be a member, you have to abide by certain business codes and ethics, minimum standards of service. So that is one good way to know that when you're making that referral, that's a little bit of peace of mind, being that we're in a totally unregulated industry, that an OSNAHA member has been vetted in that manner there. If you would like to reach out further, I did put my information in the chat box there feature. But again, yeah, I'm Jude Terrace, board member with the Arizona In-Home Care Association, and I'll turn it back over to Kyle if there's any questions.
Fantastic. Thank you, Jude. Yes, any quick questions for Jude?
I have a question. How would you know? Would it just be a phone call to the organization to find out if a company is vetted?
Yeah, so easier than that. Go to our website. It's AZNHA, which again, I put in the chat feature, AZNHA.org. And in there, on one of the headlines, I think it says, I can't remember exactly what it says, but there's where you click to see who the members are of OSNAHA. I think it breaks it out by region. I think it breaks it out alphabetically, several different ways there, but you could easily see right then and there if they're a member.
Great, thank you.
Yeah, absolutely.
Awesome. Well, thank you again, Jude. We really appreciate you joining us today and explaining OSNAHA to our group. You'll find contact information for OSNAHA in the current Spotlight Resource Guide on page 16. So further information is there for you too. I have to say it's been wonderful seeing all your faces again. It's great that we can come together at least on Zoom, but we look forward to our coming together in person again here soon. We do have just a couple of minutes for a quick announcement and some door prizes. Does anybody have a quick announcement and a door prize? Or a door prize? Melissa.
Good morning, everyone. This is Melissa, Elder Care Advisor in Northern Arizona for Jackson White Elder Law. And I do have a $10 Starbucks gift card, which would be nice for those of you, especially in the cold country right now, get something warm. I'll have George spin on that. But before I do, I just want to announce that we do have an All-Tex Basics webinar coming up on May 20th at 9 o'clock. You can register for that at our website. I put the information in the chat bar as to how you would access our website. And we also have several in-person presentations starting down in the Valley. I would be happy to do in-person presentations up north here. I just need hosts. So if you are interested in partnering with Jackson White on that, please reach out to me.
Winner was Stephanie Ramsey.
Wonderful. All right, I'll get that off to you, Stephanie.
Fantastic. And thank you, Melissa.
Thank you.
Jackson White is a corporate sponsor of the Spotlight program, so you'll see them there as well. Thank you so much.
Kyle, I have a gift card.
Oh, thanks, Mary Lou.
It's Lazy G Brew House, and it's a meal for 2 people. And I didn't know what to do, so do I just tell you I've got this?
Yeah, and George can help us out. He has a randomizer. So
okay.
Excellent. And looks like the winner is Denise Dunker.
Oh, I'll see you tomorrow and bring it.
Yay.
Okay.
Okay, anybody else? Well, we do have one from Spotlight. It's a gift card to Starbucks as well. George.
Yep. And it looks like the winner is Nancy Bowers.
All right, terrific. Nancy, we'll get that over to you.
Thank you.
I want the dollar speakers again. What's that?
I have a quick announcement.
Yes.
I attached a flyer. We're having a Longest Day fundraiser campaign along with the Alzheimer's Association. And we are looking for sponsors. It's going to be in Prescott at the Washington School, which is on Gurley Street in the Grassy area. We're going to have like a little yoga festival, and we're going to have a mini information fair. We're not calling it a health fair because it won't be all healthcare providers, but if you're interested, you can contact me if you want to be involved in that.
Awesome. Thanks, Candace. Okay, anybody else? Robin, did you have anything else you wanted to share?
Yeah, I just wanted to say that I have so enjoyed being with all of you through this year. It's been an amazing year. I don't usually get to see all of you. I'm just the woman in the phone. But next month is our last live Zoom event. It'll be May 25th. Hope cross your fingers. And then after that, in June, on June 22nd, we are going to go live again with a in-person spotlight event, and it'll be hosted by Beehive Life Village. And we're excited for that, but I just wanted to say I'm going to miss you all and miss seeing you and sharing in your light. So anyways, just keep that in mind that we're going live in June, and hopefully we'll be able to stay live and we won't bounce back to Zoom events, but you never know. So thank you.
Thanks. And thanks to all of you. You inspire us. We're here for you if there's something that we can support you in doing. You work for wonderful companies that provide great services for our senior adults, and I commend you on that. Thank you for caring for our seniors. Go out there, have a great day, be safe, and we look forward to seeing you next time. Thanks so much. You can unmute yourselves and say goodbye to each other if you'd like.
Thank you.
Bye.
Bye.
Bye, everyone.